I'm Nishani Singha. I'm a consultant ophthalmologist at Southampton University Hospital's NHS Trust. I'm a glaucoma and cataract specialist, and I'm also the past president of the UK and Air Glaucoma Society. The optometrist is our gatekeeper because 50% of glaucoma is undiagnosed.
We all need to work together to make this count, and the biggest thing we can do is actually proactively call for change.
And really calling upon government, who we believe are definitely quiet at the moment around their plans around chronic care, especially glaucoma, and the need for us to have a national eye care strategy.
So what we really need in glaucoma care is timely diagnosis and appropriate follow-up. And what we need is policymakers to realise how important glaucoma is. It affects 2% of the population over the age of 40 and 10% of the population over the age of 75. So these patients need to be picked up and also have timely management. We need the healthcare and policy makers able to provide the resources so that we can do this.
I think optometry and ophthalmology have to work together with defined pathways to make sure that we can do, good for patients with glaucoma and reduce avoidable sight loss.
No matter where you are as an optometrist, whether you're in Northern Ireland, Scotland, Wales or England, upskill yourself, become the best clinician you could be, but also don't forget, for the vast majority of people that you see, there's a healthcare message that you can give them that'll make people able to go out and talk more eloquently to others in their network and access care. There's still 1 in 4 people who don't access regular eye care, and we all have a responsibility, no matter what our role is, to help people to understand that they should be accessing services.
And we have a really defined model. When you look at Wales or we look at Scotland, we can see what the future needs to look like. We just need to convince policymakers and stakeholders that, in England, that is the future for eye care in England.
If these patients aren't looked after, the morbidity that's associated with them affects social care, affects all the other parts of their funding stream. So if we pick up these patients early, we'll make them live well with their chronic diseases, and they won't be such a burden to the whole overall healthcare and social economy.
We don't always think about the secondary and tertiary issues with people's eye health, and it's a massive one. Of course, with the technology that we have now with SLT and now MIGS, there is a way to give people far better outcomes long term, and some people are even able to go without drops. Now those drops, they're a huge ball around the ankle of certain people because ultimately they've got peripheral neuropathies, difficulty putting them in. And for most people, they will have some ocular surface disease as a result of repeatedly using drops on a daily basis. So if we can give them a drops-free life, they'll be more concordant, but ultimately they'll have better outcomes.
We need a national eye health strategy for England now that includes glaucoma and other chronic conditions, but the answer is now. It needs to happen now. Every day, more and more patients are losing their sight needlessly, which is an absolute travesty.
And then our real key message was the importance of Glaucoma UK as a pastoral partner to healthcare professionals in helping the well-being of patients. Glaucoma UK have all the resources and the time to help the patient's well-being as well.